Uses. Until now, coronavirus had been limited to humans. The origin of this virus is unknown, but certain animals, such as birds, are known to act as reservoirs. As is other viruses that cause pneumonia when they are transmitted in humans, the infection usually occurs through the respiratory route, through the respiratory throats that people produce when they cough, sneeze, or speak. Everything seems to indicate that the new coronavirus causes COVID-19, also not all human coronavirus, has an animal origin. In fact, the first case had been related to a live animal market in the city of Wuhan in China. The SARS coronavirus is believed to have originally from bats sequentially developing to some other small mammal species such as the civet and selection the human. Preventions. The new mass coronavirus SARS-CoV-2 has been found to survive on various surfaces for several years, copper called Harvard, and even a few days, vaccine stands still. However, it must be borne in mind that the amount of variable viruses discriminating over time and there is not always present and under surface in a sufficient quality to cause infection. Maintaining basic hygiene is the most effective way to avoid contracting these virus in places where there is a great risk of transmission. Many areas where cases have been reported in and unable to wash your hands quality and avoid contact with people who are already infected, especially protecting your eyes, nose, mouth. People infected or who think they may be are advised to wear face masks and to use headphones to cover their nose and mouth when cold or sneeze. Diagnosis. To determine the parenthesis of coronavirus infection, doctors may take a nose and throat nasal field hair or blood sample. There are different stages of coronavirus diagnostic tests. In case of suspicion of coronavirus, a chest thermometer is usually referred to determine the symptoms of pneumonia as well as blood closing tests as biochemical tests, and a blood count antibody tests are also known. Likewise, in order to control the transmission, a evaluation is made of who people who present their symptoms and who become from the content of the virus. The control of temperature with temporal cameras and digital thermometers of people arriving at a report from affected areas has been one of the measures that have been put in place. They detected possible cases of COVID-19 as did with the previous shots. Questionnaires are also conducted for travelers. In case of suspicion, they are under evaluation and, where appropriate, they are transferred to health centers. Treatments. There is no specific treatment or vaccine of SARS-CoV-2, but multiple vaccine monotypes are being investigated at different stages of testing and various combinations of drugs, as well as the use of plasma from recovered patients. In summary, the steps of respiratory infections are treated with antivirals at the discretion of the health professional and supervised measures. Treatment is usually adapted according to several of the patient, since there are cases in which severe pneumonia occurs, with in others the manifestations are child.